fertile will the woman be after the age of 30 to 35 and then to 40? Now, from my earlier video, I talked about how fertility declines with age. And the fact is, you are not going to remain fertile all your life, like very, very fertile all your life, because as you were growing, you were aging. That is how your fertility level is declining, because every girl is born with a fixed number of egg in the ovarian reserve, and that is about 1 million. As soon as the onset of menarche begin, which is the very first menstrual period, this egg begin to deplete. The ovarian reserve begin to deplete. As the egg is reducing, the quality of the egg is also diminishing, and so chances of having babies with chromosomal issues like the trisomies, the Down syndromes begin to increase. So yeah, we're going to be looking at how to maintain fertility even as you age as a woman. One thing that you need to know is that fertility kind of peak. Now, between the age of 18 to 22, a woman is most fertile. At this point, if you want to actually have your babies, you can actually have them very easily. For those that have no issues with their reproductive health, their fertility, you can have babies very easily. But as you begin to age to 28 to 30, fertility begins to reduce. Now, from the age of 30, your fertility level can still be optimal to some extent, but as you hit 35, the decline begins to increase the more, because of course the hormonal secretion in your body begins to decline as well, begin to reduce, and then by the time you hit 40, also it further declines, and so the level of fertility declines as you age. You discover that your ability to conceive becomes reduced, like difficulty in conceiving increases. Now, from the age of 30, the chances of conception is between 20 to 25% in a cycle, and that is why I always tell women, you don't need to beat yourself up if conception didn't happen in a cycle. The chances is just 20 to 25%, so like about 70 to 80% chances are lost. So yeah, you're left to 20 to 25%. So all you need to do is to try the next month if you didn't succeed in this particular month. So we are going to be looking at some of the things that you should do on a regular basis to help increase your chances of conception. Even though you are getting old, all of this will help maintain your fertility across age. So don't go anywhere, and ensure you watch this video to the very end, and please don't forget to give it a big thumbs up. That is very important to helping this video get visibility. The number one thing that you should do as a woman as your age begins to increase is to take 1 tablet of folic acid on a daily basis. Now, the number one thing you should do is to take 1 tablet of folic acid daily. A tablet of folic acid is equivalent to 400 micrograms. Just in case you're getting one that only comes, you just see 400 micrograms, it's still the same as 1 tablet. So make sure you're taking 1 tablet of folic acid on a daily basis. This is going to help in formation of healthy babies and also reduce the chances of chromosomal abnormalities. Remember, I said that by the time your age is increasing, the chances of you having babies with chromosomal issues also increases. So yeah, by the time you're taking folic acid, it will help you to bring forth healthy babies. The number 2 thing that you should continue to do consistently is ensure that you maintain a healthy weight. Ensure that your weight is at the optimal level. Don't gain too much and don't lose too much. Just make sure you're maintaining a very healthy weight. That way, your chances of conception will continue to be evergreen across age. Now, the next thing is to exercise regularly. Now, you need to have a consistent schedule of exercise. 3 times a week is perfect, but make sure it is consistent and it is regular. Exercise is not equivalent to walking from your bedroom to your kitchen to cook, washing the dishes, washing your clothes. That is not exercise. And it is not equivalent to working on files in the office, moving from your office to your boss's office to submit files. That is not equivalent to exercise. Why one of these activities produces stress and releases stress hormones, another help to increase blood flow through your system and then improve optimal functioning for all your different organs, reproductive organ not exclusive. So ensure that you have regular and consistent exercise schedule if you are going to be conceiving in the near future, as this is going to increase your chances of getting pregnant across age. The next thing that you will do is to avoid smoking. Now, smoking is very detrimental to your health as well as your reproductive health. If you have any intention of having babies, even as you increase in age, make sure you avoid smoking. This is going to affect your chances of conception. So if you know that you smoke and then you are trying to conceive, then you need to avoid smoking as much as possible. The next thing that you will do to help increase your chances of conception despite age is to reduce alcohol intake. If you're someone who is addicted to alcohol, who takes alcohol on a daily basis and in large quantity, please, it's time for you to reduce the quantity of alcohol you consume, because now your age is increasing and then your fertility level is going to decline. Now, taking alcohol is going to further reduce your ability to conceive. So you can consider keeping alcohol aside completely or reducing the quantity you consume from time to time. Another thing that you should do is to increase your vegetable and fruit intake. Now, fruits are very important in maintaining the female's reproductive health, increasing female fertility, boosting ovulation and all. There are fruits that boost ovulation like avocado, like pineapple, like banana, apple. These are some of the fruit, the berries, strawberries, raspberries, blueberries. This will help boost ovulation. And once ovulation is boosted and quality eggs are produced, then your chances of pregnancy, a healthy fertilization, if there's a presence of a sperm and then a healthy pregnancy, is increased. So make sure that you incorporate lots of fruits and vegetables into your daily diet. As you begin to age, especially, the importance of these fruits and vegetables cannot be overemphasized. Now, these are some of the things that you need to do as your age increases to increase your ability to conceive. Make sure that stress is kept away as much as possible, because once you're stressed, a negative hormone is secreted and this hormone is going to impact your system negatively. So make sure you avoid stress as much as possible, avoid toxic environment and anything at all that will pose as a danger to your reproductive functioning. So yeah, if you are not planning to get pregnant immediately, maybe you want to school, you want to acquire some degree, or there is no life partner coming at the moment, you can do all of the things I've mentioned. And if you are capable and you're in a region where there is a possibility of egg freezing, you can opt for egg freezing. This way, viable eggs are retrieved and then freeze. And then when it is time for you to conceive, you're ready to conceive now, you can go for retrieval and then it is used for you. So this is what you can do if you do not intend to get pregnant immediately and you have the means to actually access these egg freezing services. Thank you all so much for watching this video. Make sure that you don't get yourself worked up during the process of trying. Like I said, stress is very detrimental to your ability to conceive. So make sure that you are just optimistic, and trust me, pregnancy is going to come when your body is ready. So kindly like the video if you've not done so at this point. For other videos on how to boost ovulation and also other tips on how to actually maximize the fertile period for pregnancy, like how to calculate your ovulation period, your fertile period, you can actually check the link in the description, and you can also just scroll through the video on videos on the channel to watch. So thank you for watching. See you again in the next video. Bye.